In the middle of 2020, so July, I contracted a UTI. I had chronic UTIs and kidney infections beforehand, so I thought, oh, it's just another one of these. It'll be okay. And I rang my GP and they said, can you send in a urine sample, please? So I sent in the urine sample and it was less than like 20 mils. Um, and I hadn't been for a couple of days. And they dipped it and they said, oh, we think you need to go into hospital. We think you might have a kidney stone. So I went into hospital into the short stay emergency unit and I had bloods. Well, I got there, sorry, I got there and I had my observations taken. Um, and everything was absolutely haywire. So I had like a heart rate of 160 something. My blood pressure was in the 80s. My temperature was 39.6. Um, and then literally got up to get on the bed and collapsed. Um, and little did I know that that was the beginning of my new life sort of thing. I thought I just had a general infection. Turns out I was septic. So I was in for about 2 weeks on IV antibiotics. And the day I was due to go home, I had this really weird feeling in my jaw. And it was like one way of my mouth, one part of my mouth was going one way and the other part was going the other way. And when my dad came to collect me, it was my first ever seizure. And from there on in has been quite hellish, to be honest. I ended up being in another 6 months after having cardiac arrest during one of my seizures. It's been a long process. And then I came home at the end of 2020, just after my 19th birthday. And within 6 weeks, I was back in ITU with septic shock for three weeks, and then I then had another like 2 month hospital stay as well. So um, yeah, it's been very difficult to say the least. It's just been havoc since I'm on medications for the seizures, which until recently hadn't been quite controlled, but touch wood, they're more controlled now. But I've been in ITU with my seizures. I've had multiple ambulance trips. Um, and then due to the seizures and the cardiac arrest, I became partially paralyzed as well. I'm in a full-time wheelchair. Yeah, sepsis has very well and truly impacted my life that I never thought anything could, to be honest. I was happy, healthy, playing a lot of sports, getting ready for uni and driving, and all of that is sort of disappeared at the moment. So visitors were non-existent and all of these things. So it was a very, very difficult time, yeah. I didn't really have much support whilst in hospital. Um, I was put on some antidepressants and things like that, but I've not had any therapy for it. But we are now building up to that, nearly 5 years down the line. Um, I wasn't aware that the UK Sepsis Trust offered anything in terms of mental health support. So it's been a pretty much go it alone sort of thing. And I've got to say, it has tested me at times a lot. It has been quite difficult. Obviously, I I woke up one day after a major seizure and cardiac arrest, and I was no longer able to move my right side. My head was practically on my shoulder, my arm, my leg was paralyzed, couldn't sit up very well, you know, all my basic autonomy and not my dignity because the staff were amazing, but my life before was, I pretty much realized it was gone. Um, and learning to change the ways you do things. And I know I was only 18, 19 at the time, and I'm now 23. But it was my whole life before. I hadn't changed anything, nothing had changed, and to have to do things differently. So things, like being hoisted or using a commode or using a wheelchair, and even just finding the right wheelchair for you. I was quite not ignorant because I've got family with disabilities, but I thought once you're given a chair, that's your chair. It fits you, it's perfect. I think I'm on chair number 6 or 7 in these 5 years, and this is the best chair for me at the moment. But even if two chairs look the same, they don't feel the same to your body because they are your new limbs, they are your new way of traveling. It has got to be perfect for you. It is a part of you, which I have learned. Um, and learning to use new equipment and having specialist adaptations. I've got to say there is a lot that can be done for disabilities now. However, it still requires a hell of a fight. So not only do you have to fight to recover from sepsis, I think a lot of people think, oh, you're disabled, you're going to get this, this, and this. Um, but you have to fight, and if something doesn't fit you properly, and the health professionals say, oh, that should do, you say no. You know, this is my body. This is my life now. I need to make sure that I've got a quality of life. Um, yeah, and especially being a younger person, I've found that everything pretty much is catered more to the elderly or more to those with learning difficulties, and things like that. So finding help from different services that know what they're doing with myself, has been quite a struggle, and trying to get people to understand, that young people need help as well. It has been a difficult thing, and that's what I'm hoping to try and work towards, is getting better care for not just young people who have fought sepsis, but young adults with disabilities on the whole, to be able to have, almost a streamlined process, which would make life a lot easier. But yeah, I've got to say, my parents both work for the NHS in different capacities, not as full-blown medics or anything. And I've got to say that whilst being an immediate patient in an acute setting, um, it has been overall very good. I definitely owe my life to the NHS on multiple accounts. It's just the follow on from that, um, and things as simple as wards not being equipped for younger people, not being many younger people there. I was on wards with people 4 or 5 times my age, um, which I know can't be helped, and dementia patients, which I know can't be helped. Um, but there was nowhere for me to go and almost not have a break, because you're never going to have a break from the cards that I've been dealt with, but almost to connect and distract and all of those things. My saying has been for years, there is a children's hospital which catered to about 16, um, and then you go straight into adult life. But there's also something called a teenage cancer trust, and they look after people till, don't quote me on this, until they're sort of early to mid 20s. So why can't there be something for the general population? Um, it's a very difficult situation to be in, and I think having people around the same age or similar experiences, and things like that would benefit people massively, and that follows on to social care as well, definitely. So I initially came home to live with my parents, and I lived in the living room in a bed with a hoist, and that was my life for 6 7 months. I then moved into a care home out of area, um, for about 7 months, and that was a difficult experience. And then I moved into supported living for another sort of 6 7 months, and I finally moved into my own flat with full adaptations, and I have carers multiple times a day to help me with everything. I still rely on the carers for a lot. Um, and there are discussions about care packages changing and things like that, whether it's increased or not. Um, but I've got a place to call my own, and I had that at nearly 21, which I'm not sure a lot of people my age could potentially say. Obviously, if it weren't for the sepsis, I wouldn't be living semi-independently. I wouldn't have my place to call my own. I'd probably be living in uni dorms and stuff like that. But yeah, this was a big step. Um, with my parents, it's difficult because my dad works in A&E, but he's like a nurse and associate healthcare support worker, and my mum is very much on the admin side. Um, so yes, things have probably been in certain areas with appointments or bits and pieces like that have been slightly easier, um, due to my parents being in healthcare, and obviously they're a bit more clued up now on what to sort of look out for and check that I'm doing okay, because I'm still quite resistant into going into hospitals for any sort of reason. Um, but I know they've had a lot of support from their work families, which obviously, say you worked in an office, a lot of people might not understand what sepsis is. And even though my mum is admin, a lot of people knew what sepsis is because on the left there is sepsis 6. Um, and in A&E they see it all the time. So they had a lot of support in terms of that. Whether excuse me, whether they might have struggled. I'm not bad mouthing my parents. They have been absolutely amazing. They've been through traumatic stuff. I remember my mum and dad saying to me, each time you go in an ambulance, we don't know whether we're going to see you alive again. And that sort of pulled at me. But they've seen me have CPR, they've seen me go into comas, they've had a discussion that I might not wake up. Same with my sister. She was 13 at the time. She's now 18. But I'm pretty aware that they've had those conversations. Um, but I think they've still struggled in some ways to almost know how to help, because they're sort of stuck between, well, Holly, you've got to do this yourself, but also I really want to step in, but also, well, you need to speak to this person and that person, and you need more of this and you need less of that. Um, which at 23, when you're living on your own, having your parents sort of nagging you is a difficult thing to combat, because you can't go, oh well, no, or yes. With it being COVID, obviously, there was a lot of decrease in sort of face to face. Um, and I just rang up and I said, I've got a niggle in my back. I think I've got another UTI that's potentially gone up to my kidneys. I wasn't feeling particularly unwell. I was in a bit of pain. I felt a bit sick, but that's nothing out of the ordinary for me with a kidney infection. And then yeah, it just went mad. I'd heard of sepsis, and I'd had appendicitis before where they queried I'd been at the beginning of sepsis, so I'd been given the three antibiotics and the fluids and all of that before I had my appendix out. Very much heard of sepsis and things like that. Did I ever think I was going to get sepsis? Especially to the extent that I did? No, I thought I was a healthy 18-year-old. I was playing sport at quite a competitive level, at a high level. I was doing well in my studies. I had everything mapped out. Um, yeah, and obviously having parents who work on the wider aspects of healthcare, you do understand things. And my cousin had had sepsis before. But I think a lot of people's misconception of sepsis is just an infection that's just a bit worse. Um, you know, it's a lot more than that. It does things to your body that is insane. I was very lucky to keep all of my limbs. Obviously I've lost the use of part of my body and I've been left with long-term adverse effects that still seem to crop their head out of places when you think you're done. But people lose limbs, they lose their life. Um, it's not just an infection. It's not just a bad infection. It is so much more than that. It shuts down your organs. It's insane. I'm definitely a lot more aware of it. And if a friend or family member or whatever says, "Oh, I've got an infection," I'm like, "Right, so if this happens, or this happens, or this happens, then you go back to your doctors or you go to A&E." I said, "And if it turns out not to be sepsis or anything, that's perfect." I said, "But do not, do not take any chance." I said, "Because, you might be fine after sepsis, because I know there's three stages of it, isn't there? There's sepsis, severe sepsis, septic shock." Um, but I said, if it's not sepsis and it is just about a nasty infection, then that's fine. But if it was to develop into something like severe sepsis, septic shock, I said, you could end up like me, or worse, or even die from it. Um, and I think some of them think I'm being overdramatic until very rarely, if they're being very stubborn and I've got a gut feeling. I'm not a medical professional, but I I get what it's like to feel like it, and I will then pull out maybe a couple of photos of my journey and be like, um, so this is sepsis or septic shock or whatever. So go and get yourself checked out, like they'd rather you be there and just need oral antibiotics or a couple of nights in rather than, you know, so much worse. Normally that
Yes.
gets them that gets them going, or I'm like, well, Google sepsis then. Like get your head screwed on. But I'm very different again in that way. I'm still very stubborn to go into hospital. even though everyone else has a very low threshold for sending me in, I still have a very high threshold. People think it's not going to happen to them, but it could be from a sore throat. It could be from a tiny paper cut on your finger. It could be from a UTI. It could be from any source of infection that you can imagine. Sepsis can then develop. Um, so any signs or symptoms of an infection, firstly get it checked out, and secondly, if that infection seems to be getting worse, then you go back and you ask the question, could this be sepsis? You know, and even if people think you're being overdramatic, it doesn't matter because you want to catch it as early as you can, and you want to keep yourself in the best shape possible with the best and earliest treatment possible.